Nancy Carlson.
And I'm Candy Whitman.
And welcome to the Health and Wellness channel. Tonight we're going to talk about what is holistic nursing.
Why don't you start, Nancy?
Thanks, Candy. I'm here to share the news about holistic nursing and all the different holistic modalities that nurses can use in their practice for their patients and clients. I am an educator of health and wellness. I am putting this out there to spread the news to a larger audience via this media. Welcome back. We are going to continue this conversation about holistic nursing. Candy.
Hi. Nancy, when did you become a holistic nurse?
I graduated from Boston University School of Nursing, and I started work at Mass General in 1975. I had already had a yoga and meditation practice since I was 18 years old. I started to continue to explore more holistic practices as a nurse that would help me healthy and also about my patients. First was therapeutic touch. It was an energy-based healing that facilitated a healing response by not even touching somebody. I used it quite often on patients and myself and my family. It brought comfort and relief, restoring harmony and balance, gentle and effective. Next, I found this book and a lecture in Boston on death and dying by Dr. Dolores Krieger, if you know her. Using her knowledge wove into my nursing over 40 years with patients, clients, family, and friends.
And how are you? You're a practicing holistic nurse now.
Yes.
So
now
what are you doing?
I'm mostly in private practice. I'm an independent nurse. I work with groups also in the community. I use different holistic modalities that bring more awareness for clients and meeting them where they're at and what their decisions and choices are and what are the best options for them. But what's most important, it's really about their own self-care, and that's when the clients come to me, is how they can have a healthier life. I work with the client and their provider around what they need for better health and wellness. I stay present, I listen to their story, I take the time, their concerns. I also support and educate clients to choose what is right for them, and so that they can maintain their Western medicine provider with holistic modalities as complementary care. Mostly people come for poor diets and lifestyle, arthritis, sleep issues, depression, anxiety, chronic pain, osteoporosis, and even more. These modalities, the clients can increase their own awareness and to empower themselves and make healthy choices in boundaries in life.
Let me ask you, is nurses, how do we take care of ourselves so that we can take care of others?
Oh, that's a great question. Something that I've always tried to research. As nurses, we work really hard. We can have a burnout at some point. So the self-care can go out the window for the nurse. The system that we're in now is fragmented so that when a patient comes to the doctor or the nurse, they only have like 5 or 10 minutes. And that's also the self-care for the nurse or the doctor. So both are very important. So for us to work with other people, we have to take care of ourselves, or we're not going to make it. We're not going to continue to be a nurse with the burnout. We have our own habitual patterns that we're not taking care of ourselves. We get in the way of our patients with our own poor self-care because they have needs also. So we have to be there for them. Or we have to be able to mirror them so that they can also start learning how to take care of themselves. So how to do that is to cultivate awareness by taking time for yourself, focusing, bringing in harmony and calmness with certain practices and groundedness. Also, healthy routines such as eating well, sleeping, exercise, and managing my own emotions. When we take care of ourselves, we're finding new ways of caring and becoming an actual healing presence for our patients. And when we don't take care of ourselves, there's frustration, tension, burnout, anger, anxiety that pops up in our work. It affects all of our relationships, not just patients, but our family and friends. So knowing that we are all connected in body, mind, and spirit, working with patients or clients, I find that it's important to co-create a plan of care. And that is very, you go by that person's, you respect their health beliefs. We honor the patient's values, the preferences, and the diversity.
So then how do we manage our stress? Because that's inherent in the healthcare system or taking care of us. So what's your opinion?
That is part of the self-care. And like you said, in the system right now, there is a lot of stress because of the timing. Because patients are only heard for maybe 5 or 10 minutes, and we also have not any time to see people. And then we have more stress in ourselves that we are trying to care for people, but the stress is overload. So normally stress is always a part of life, but when it becomes chronic, like you're in a situation, the kind of work that we do as nurses, that stress becomes very chronic, which can be causing diseases. So then there's the managing stress is preventative. So working with stress in a way that if we manage it and we learn from the healing modalities, we can start to use prevention so that the stress is there, but how can we not make it chronic all the time? That we can care for ourselves, that the self-care can come into that.
Yeah.
And a lot of that is taking making different choices in our lives, and our reactions around stress, and instead of that, stepping back, not reacting negatively, but actually just pausing and just waiting to see what is this feeling going on, what is happening right now. And that's the most, it's the most important thing we can do to change our routine, that that we do take care of ourselves. By assessing our own priorities, we make healthy boundaries, and our best decisions for us, what we can control is helpful, but sometimes we can't control anything. But we can accept. We have to accept what it is. So Candy, what is holistic nursing?
People ask that a lot. Holistic nursing is essentially a shift in perspective, away from just focusing on a patient's diagnosis, their chief complaint, and really incorporating their chief complaint into the whole person, the mind, the body, mind, and spirit. So as a nurse, nurses have a background in science, anatomy and physiology, psychology, medicine. They interact with people across a lifespan, from their first breath, working with babies, or to somebody's last breath, working with the dying. We work with acute care. You may have a 2-hour interaction with somebody in an emergency room. On the other side, you may be seeing somebody coming in throughout their lifespan because they have a chronic illness or so. And you're interacting with patients in a very vulnerable position. And yet, nurses are one of the most trusted professions And as a nurse, we have a moral commitment to protect the vulnerability of those patients, and that is true caring, and probably why we're a trusted profession. In modern nursing is from the 1800s, and the whole premise was to create a condition so that the patient can get well. In other words, the patient is the one who really does the healing, and that's true now too. But going back to holistic nursing goes back to the beginning of modern nursing and Florence Nightingale, and she's another fascinating person. But it was creating the conditions so that healing can happen. And in the current environment, nurses are, modern medicine, we've come so far, but we're busy with technology, with charting, with insurance. We're pressed for time, for resources. So holistic nursing is a framework which is based on the core value of, as I said before, early modern nursing. Holistic nursing is recognized by a specialty, which is exciting, through the American Nurses Association, which is responsible for credentialing nursing in the country. And the American Holistic Nurses Association and the American Nurses Association jointly authored Scope and Standards of Practice for Holistic Nursing. So you don't need to be a holistic nurse to be respectful and caring, but holistic nursing specifically talks about it. It has a whole philosophy and a framework. It's the foundation of everything else. And some main points about holistic nursing are that there is this framework and philosophy and standards of practice that exist. We treat the whole person, the body, mind, and spirit, which is significant. Then there's relationship, which is very important. And I had mentioned earlier about the trust between the public and nurses, but in holistic nursing, the relationship itself is a topic of holistic nursing, about honoring. There's research done on the relationship between the nurse and the client. And it's all based on honesty. There's more of a partnership versus the nurse having all of the control. And there's listening, real listening. That's a real shift. The patient feels heard. The nurse has more information. The patient feels more comfortable giving more information, more story. And there's self-care, as that you had talked about too, which is huge. Managing stress, being mindful, being stressed and distracted interferes with care. And self-care can be a scary step to take, a whole new world, and struggling may even seem preferable. But within holistic nursing, there's different modalities, which we'll be talking about in future episodes, and we'll be hearing from other professionals and professions that have a holistic mindset too. So now we're going to be doing some skits to act out what we've been talking about and see if you can see the difference, right? We'll be right back.
Here I am. I don't even know how to put this thing on. It's Johnny. I think that's what they say. I never do it right. Oh my God, my head is killing me. This migraine of all days. I have a...
Are you ready? Almost ready?
Not yet.
Okay, middle-aged, a little older, woman with the migraine. Okay, she's not ready yet. Probably looking for Botox. Migraine. Boy, what a day I've had. Some jerk took my parking spot. I think I know who it is too. Oh, what an idiot. Oh, what am I going to have for dinner tonight? Oh, they always want something fresh, gluten-free. It's always up to me what to have. Oh, what am I going to wear with my new dress too? What am I going to wear with that new dress? Anyway. Hi, hello. Ready? Hi, nice to meet you. Hi, I'm Doctor. I see you're here for a migraine headache. I just don't mind me. Do you get an aura or anything? Anything that precipitates? So just let me know when you see my finger. Okay, just a quick neuro exam. Have you seen a neurologist at all for these migraines?
A neurologist?
No one's suggested a neurologist.
One of my friends told me I should have lavender.
Yeah, no, we're gonna send you just for a neuroconsult. Don't worry, the medical assistant will get you set up.
Can't you just give me a magic pill or an injection?
An injection, Botox. See? Yeah, we could do an injection. I mean, there's injections of Imitrex, Toradol, whatever. I don't know if we would go to Botox right now.
So you're talking about medicine? What are the effects that could happen with all those medications?
A questioner. Sorry, lady, not today. I don't have time. I'm not a pharmacist. No, they're well tolerated. Actually, why don't we just go into some? I'll just write you a prescription for an oral medication. They're well tolerated. There's a handout from the pharmacy. Don't worry, read it and let us know if you have any questions. Please not. Okay. All right. So, oh, your boots are terrific. I really like those. Those are awesome. Oh, this. So I think you're going to be okay. So a neurology consult, we'll send your prescriptions over to your pharmacy, et cetera, and the medical assistant will take care of you. And your exam from here works out fine. So I think you're all set. If you have any questions, be sure to let us know. Okay, thanks for coming.
Why are we switching? Why am I going to see a neurologist? Does she think I'm going to have cancer? Is that what she isn't giving? Is that why she isn't giving me a shot? She likes my boots. Is that all there is?
Hi, so you must be Nancy. Hi.
Hi, thank
Nancy.
you.
Hi,
Yes.
I'm Candy, I'm a holistic nurse. I'm really happy to see you. So are you comfortable before we get started? Can I get you anything? Any water? Is the temperature okay? Would you like to be lying down?
No, the medical assistant took care of that, and she offered to let me recline or lie down. Lying down would be
good.
great, actually, if there's anywhere I can do it. I'd actually go into a fetal position around this migraine.
So you get that comfortable. Okay.
Yeah.
And I read your paperwork, and could you tell me a little more about you were getting migraines? Have you had them before? What sets them off? What patterns have you noticed? Tell me anything about them you'd like me to know.
Unbelievable and open-ended questions. She's very nice. I've only had a few headaches, headaches, but today I'm supposed to go to this meeting at work and I can't miss this. It's really important. I thought if I came in and I could see if a healthcare provider would give me some advice or a treatment.
Well, so it sounds like the meeting's important to you.
Very important to me.
And this headache's not happening at a good time. Are you sure you can go to a meeting? Do you feel up to it?
I don't know. The nausea comes too with the dizziness, and there's kind of like this booming thing over here. But wait a minute. I mean, you know, rest is what I really need. But I'm just realizing now that maybe I can go by Skype to this meeting. Maybe I don't have to go, and that way I can lie down on my sofa in the living room, and I could handle that. And do you think lavender actually helps?
Wow, now this is terrific. I was going to tell you that the medications that are most popularly used for migraine headaches can have some side effects. So, you know, do we want to consider that today? You've already done some problem solving that you can do the meeting, but if you're lying down and you're thinking of lavender, and absolutely lavender can be of great help. A lot of people find that it is. And what else helps? What else have you found?
Cold water, drinking cold water for sometimes,
that.
And then eating, actually cucumbers help me.
Okay. Oh, terrific.
I know it sounds crazy, but
terrific. No, that sounds terrific. There's a lot of different modalities. There's a lot of reasons for migraines. There's a lot of different treatments and modalities. So if you, I'll let you get home, but then feel free to come back, and when we can get into this in a little more depth. But there's a lot that can be done for prevention, following patterns, et cetera. So thank you for coming in. I hope you get some relief.
Thank you so much. There's no magical cure, I know that, but
Yeah.
I actually feel better already.
Yeah, I'm glad to hear that. All right. Take care.
Thank you.